we shall see what are the siddhantas involved in Ayurveda, which we are practicing in our daily clinical practice. Okay. See, there is a story that Atreya went to Indira and he studied Ayurveda. He learned Ayurveda. What is according to Charaka Samhita, what is that principles the Atreya learned from Indra? It's nothing but the concise of the subject, that is Samanya Vishesha Siddhartha. And he studied only the Padartha Vijnana. What is Samanya Vishesha? It's very simple. Samanya Vishesha Siddhanta. Samanya is similarity and Vishesha is dissimilarity, and similar things increase and dissimilar things decrease. This is a simple thing which can be utilized as Dravya, Guna and Karma. In these three aspects, this Samanya and Vishesha can be divided, and when the Indra told these principles, Atreya could understand how a treatment can be done, and it became practiced in the Ayurveda, and he created texts. That is what the story tells, or the mythology tells. So, Padartha Vijnanam originated from the basic principles, and the practice is Triskandha Ayurveda, that is Hetu, Linga and Aushadha. Simply telling, Ayurveda is dealing about the causative factors of the disease, that is etiology, and the diagnosis, that is Nidana, Hetu, Linga, and Aushadha, the treatment protocol. So these are the concise, or when you make it simple, these are the three things, Hetu, Linga and Aushadha. So they are the siddhantas to be applied. So whatever the Samanya Vishesha Siddhanta, it can be explained in Ayurveda and it can be practiced for a disease manipulation. So we shall see what is it. So what is the application? Application is just Chikitsa only in Ayurveda. And Ayurveda is a Prayogika Shastra. It is not a Mimamsa or something. It is a Prayogika Shastra that patient is having pain in the body and we have to relieve it. And Nahi Jivita Dana Adi Dana Manyat Vishishyate. Whatever may be the greatest thing what we can give to a human being is that giving the life and relieving the pain of the patient. This is what the entity of Ayurveda is. From Karuna only Ayurveda was originated. From the empathy only Ayurveda was created by the Munis who had no personal things. That is, Rishis has no personal things. They were doing it for the empathy, from the empathy of patient to relieve the disease from the patient's body. So, Prayoga Shamaye Ityadhi. So, what the Prayoga is, it should relieve the disease from the patient. Okay. So, this can be divided into widely two things. That is Swasthasya Swasthya that is preventive aspect, and Adurasya Vigara Prasavanam, that is curative aspect. So that is also told by Charaka only. Then what are the principles we are utilizing in the treatment? Different principles are there. Concisely, I will deal with the principles we are utilizing. That is, in Ayurveda, see the man as a human being as a Purusha. And Purusha has got different entities and they are concised into Atma, Manas, Indriya and Sharira. So when a Purusha gets a disease, it can originate in any of these levels. It can originate in the Atma level, it can originate in the mental level, it can originate in the Indriya level, or it can be originated in the body level. So we have evolved a treatment methodology so that in the holistic approach, all these areas of the Purusha can be dealt in treatment. So even in the world itself, Loka Purusha Nyaya, Loka Purusha Samya. In Loka also it is there. We say God or something positive factor for this world. Like that, that is, there are two things which can be directly seen and which is indirectly we can think about it. So, if though directly we cannot see the Atma, its presence can be felt. So, Purusha Siddhanta encompasses all these areas, that is Atma, Manas, Indriya, and Purusha, Indriya and Sharira. So we have that principle, and I will be explaining that. And Ragadi Roga Siddhanta, mental disorders may the psychosomatic diseases. When a disease originates in the side, it has effect in the body, and when there is a disease in the body, it can be affected in the mind also. So that is Ragadi Roga Siddhanta. Ashtanga Hridaya Vakpada first shloka itself tells about Ragadi Roga Siddhanta. Ragadi Roga Sahaja Samula in Ashtanga Sangraha. Ragadi Roga and Satata Anushaktan in Ashtanga Hridaya also. So these are very much related, body and mind, and that also how it is the clinical experiences we will be having in the patient and how we can diagnose it. These things we shall go into detail. Then Samanya Vishesha Siddhanta, it is applied in the body, that doshas only, dosha level or body level. So Dravya, the utility of Samanya Vishesha Siddhanta is Dravya, Guna and Karma, and Panchabhuta also. And Tridosha Siddhanta, Ama Siddhanta, Karya Karana Siddhanta, Chikitsa Siddhanta, and Rasayana Siddhanta. So we shall see. So Jara Chikitsa depicts old Ayurveda. So formerly in Kerala, there was the Vaidyas of Kerala. Formerly they were teaching the first 14 chapters of the Ashtanga Hridaya. That deals about the principles. Then they will teach only the Jwara Chikitsa. Those who have intellect, they can understand the principles and the practical utility can be seen in the Jwara Chikitsa. So what are the principles told in the Sutrasthana of Ashtanga Hridaya? It is the practical approach in the Jwara Chikitsa. So when you study the Jwara Chikitsa, the different avasthas of the disease, you can apply it in any of the diseases what it may in any of the diseases. So when you learn properly the Jwara Chikitsa, we can apply it in other diseases also. So I take Jwara Chikitsa as a classical example of Prayoga Shastra of the principles. So we shall see principles and practice of medicine. Principles, Sutrasthana, and practice is in the treatment methodology that is adapted in the Jwara Chikitsa. Okay. So first one, the Siddhanta is Purusha Siddhanta. Purusha Sharirendriya Sattvatma Samyogo Dhari Jividam Nityagascha Anubandhascha Paryaye Ayuruchyate. So Sharira, Indriya, Sattva, Atma Samyoga is Purusha. So in any of these areas, disease may originate. So accordingly, we have to identify it, we have to treat it. This is the basic principles we have to know. Okay. So the disease lakshanas or the symptoms may be in the body, but the causative factors may be in the mind, and there may be symptoms in the mind, but the causative factor may be in the body also. So these things we have to differentiate and diagnose, and accordingly the treatment methodology also changes. So these we have to take into consideration. Ayurveda is having a holistic approach that it encompasses all the areas of the life. So life is Ayu, and it has got different areas. Even the treatment methodology described in Ashtanga Hridaya, we shall come into that. Even the familial patterns, familial problems may make the disease. So we have to talk to the patients and go into the details of the thoughts of the patient and find out, is it related with familial matters, and when that problem is addressed, the disease will come down. So it is not only the physical things we are going to treat, other things also, the mental things, and even in the Atma level, we have to do treatment. Okay, so what are the Atma level of treatment methodology we are doing? Shuddhe Shuklartave Sattva Swakarma Klesha Chodidaha Garbha Sambhav. And the Sraishaniya chapter of Charaka tells about our life is a continuation of the life in the Purva Janma. So the Atma is always passing through different Janmas, and Prarthana Karma, Purva Karma can cause a disease. It can be, in modern terminology, we can say it is congenital, unknown etiology also. So we don't know the causative factor, or it may be from the congenital factors. So we tell it as Purva Janma. Dushtavajarja kaschit purvavaradhaja tat sangaradhavandinyo vyadhaya. It is told in the Ashtanga. Tat sangaradhavandinyo vyadhayaha. So like that, even in Kushta also, Purvarjita karma can give rise to Kushta, skin disorders like that. It is told in the text. So maybe, we don't know, there are some of the factors which can result in the disease that we have to find out. And treatment methodology also is prescribed for Atma level in the text. So, is it correct? We don't have faith in our own Charaka, etc. sometimes. But parapsychological study, this is a book called Many Lives, Many Masters, a true story of a prominent psychiatrist, his young patient and past life therapy, and changed both their lives. This is by Dr. Brian Weiss. He is a professor of one university in the US, and he has done some experiences about the Pura Janma, etc. This is parapsychological study, and treated that lady, and she was okay. So there is some areas we should tell that in Charaka something the Acharya tells, he knows everything, he has gone through many experiences, it may be correct. So if we don't have an experience, we should not tell that it is not at all there. There may be people who have got experiences, and I have very much faith in the